afternoon. How are you doing? It's Kirsty here. I'm back at the Olive Tree Cancer Support Centre in Crawley this morning, seeing my patients, our clients we like to call them, all with varying different conditions and stages of their cancer journeys. And I was talking to one lady about her wrist. And it ties in really well. You might have seen on my page during the week that we were talking about healthcare within the workplace. So your posture, your desk height, how you should be sitting, and there was also an information leaflet which you could download, which was all about Carpal Tunnel Syndrome, which is an overuse condition, and it affects the median nerve which runs down the side of the arm. It gets squashed and congested, and that's what gives you the pain sensations in your fingers, your numbness, the achiness, and it's really quite uncomfortable and unpleasant and quite annoying. So I was talking to her about it, and I thought I'd come on and I'd give you a couple of tips that I told her. So I'm just going to take this wristband off so I can show you. Another tip, if you're wearing gloves and you get two sweatbands, you put your gloves on first and then put your sweatbands over the ends of the glove. It stops them riding up and getting in your way. So that's why I started wearing these. Top tip. So take that off out of the way. Got your wrist. Things you can do. Nice and simple are to strengthen the wrist. If you've got a ball that's got some give in it, and you can just squeeze the ball. This one's a little bit big. Squash ball type size is quite good. And you can sit there in the evening, you could be watching television. You don't have to have your arm up or anything. I'm just doing that to show you. Just squeeze and squeeze. And it will just help to strengthen that whole wrist and the forearm muscles as well. And that's a nice, easy, simple thing to do. If you want to stretch it out, easy way is, and you have to work to your own comfort levels on this, okay? Everybody will be different. So if you straighten your arm and then gently pull your fingers back, you'll get stretch under the arm, through the wrist, and you can go as far as it's comfortable. You could have it resting on something, on a desk, and do it that way. And just hold it for 5 or 10 seconds. You'll feel the tightness in there, and then you'll feel the give. And that's what you're aiming for. You're not looking to get your fingers to touch your forearm or anything like that. You're just looking to stretch through that wrist area. And the other one that you need to do is to go the opposite way. So you drop your hand, little bit of pressure on the hand. So you're now pulling the fingers back towards you. So you get stretched through the top of the forearm and down through the wrist here. And again, just 5 or 10 seconds. Oh, I can feel that one. Right along these muscles here, because I've been using them with massage this morning. 5 or 10 seconds. Breathe, relax. Again, you could have it rested on something. You could rest it on the edge of the desk and have your hand hanging over, and just keep that, and you'll feel all through there. And they're two stretches and one strengthening exercise, which is really good to help prevent or improve carpal tunnel syndrome. You can put heat or cold, put an ice pack on the area where it feels sore. Make sure that your ice pack is wrapped up in like a tea towel. That's a pretty good analogy. Wrap the ice pack in a tea towel and then place it on the affected area. That way you won't get any ice burns. The last thing we want is for you to put bare ice straight onto bare skin. If you wanted to use warmth, then you could put like a warm hot water bottle or a Wheatie pack, that you get to wrap around. Not too hot, but just enough warmth so that it feeds through the tissues and helps to alleviate the discomfort that you've got. So you can use ice, you can use warmth, depends what you feel more comfortable with. You might need to try both. Do ice in the afternoon and think, well, did that do anything? And then later in the evening, a good few hours later, you could put some heat on there and see which one works better for you. They both have good properties. Heat brings lots of nutrition and blood supply to the area. Cold will help to take swelling down and reduce pain. So you work out which one's better for you and see if that helps you. And I think that's about it. If you want to go back onto my page, it's Kirsty Wales Massage Therapies, and there are all the info leaflets about workplace healthcare. They're going on for the whole of October, and you will find the carpal tunnel one, and there's others about how to sit correctly at your desk, how to set up your desk, movement during the day, because we all get into this habit of we sit at the desk and then suddenly we get shorter and rounder, so we get tightness through the chest. You need to stretch out the chest, but we also need to move more, because we get to the desk and before you know it, it's 2 hours later and you haven't really been moving your body. So try and move every half an hour. Get up from your desk, walk around, whether you're at home or whether you're in a workplace setting. Walk around and get back down again. If it's difficult to walk around, just stand up from your desk. Just stand up and do some marching on the spot. Move your shoulders around, get some oxygen flowing around the body. If you're at home and you're allowed to, you might be able to go and make a cup of tea. But don't use making a cup of tea as an excuse not to get your work done. I'm not being responsible for that. So yeah, go and have a look at the page. If you want any more help with anything, information, you can let me know. And I'll be back at the Olive Tree again next Friday. If you need any support from them, they're a fantastic group. They support not only the person that's got the cancer, but their family, their support network, their friends. We will help all of you throughout that awful time. Information, I'm just telling you what's on the card here. Everybody is able to access the services we offer, which include information, counselling, complementary therapies, so that's where I come in and do my massage, my treatments. And we have all sorts of treatments. We have acupuncture, we have varying different forms of massage. We have support groups, we have exercise groups. Now some of them are still online, so like a little bit like exercise through Zoom, but at least it's keeping people involved. The centre is opened more than it was, so you just need to give people a ring. Good afternoon, Andre, how are you doing? Hope the weather's good with you. And you can talk to Marilyn. Is the font of all knowledge. What she doesn't know about the centre and about treatments isn't worth knowing. Opening times are Monday to Thursday. We're open from 9:30 until 5:30, and on a Friday 9:30 until 4 o'clock. You can give us a ring. You can find us on the internet, Facebook, and normally you can just pop in, but we are trying to avoid too much footfall through the centre because obviously there's a lot of cleaning going on at the moment. So that's enough waffle from me. If you've got problems with carpal tunnel syndrome, seek professional advice. If it's not too bad, try out those little tips. If you want any more help from me, you know how to get hold of me. And I will speak to you very soon. So have a fab weekend, and I'll see you soon. Take care. Bye.